Good day and welcome to Coffee with the Supervisor. We have a special guest today, someone that has worked to make sure that we stay healthy. Dr. Iftikhar, hopefully I said that correctly. She is with the Suffolk County Health Department. And the doctor and I are going to have a brief conversation today about something that we all need to do, get vaccinated. And she's going to talk about the other aspects of COVID and how her department has been in the forefront of helping us get through this pandemic. Doctor, why don't we start off and talk a little bit about yourself and what you do at the health department?
Good morning.
Good morning.
You so much. Thank you so much for having me here today, Supervisor. Appreciate it. So, my name is Dr. Shaheda Iftikhar. My background is infectious diseases and internal medicine. I have been in this internal medicine infectious disease practice for the last 27 years, with the county for 22 years. So as I mentioned, my background is infectious diseases. I joined county in 1999 as the director of infectious diseases. From there, I have been doing different other things, including I was involved in the health center and its transition. And also after that, I joined the public health division. Right now, I work as a Deputy Commissioner of Health in the Suffolk County and have been actively working with the COVID pandemic and its management in the county level.
So tell us, Doctor, the county has done a lot of things to fight COVID. I know we have here in the town. We've had pop-up vaccination sites in the town. We've had vaccination sites in the town. When this virus hit, we shut down. And I can remember my last day in the office was St. Patrick's Day, March 17th, 2020. And we shut down pretty much, and we try to operate from home. And I know some people in Suffolk County are still operating from home. But I was back in the office by June, and most of the workforce is now back at the town and has been for the last month or so operating, because there's some jobs we can do from home and some we can't. And I understand how important it is to try to be socially distant to shut down this virus from spreading. Tell us what the county has done.
So we had our first case in March 8th. And when we had the first case, obviously we had only one, and we were counting 1, 2, 3, and very soon it became 100 and thousands. So we realized that it had spread all throughout the county, and we needed to do something really drastic to make sure we have a better control of the spread of the virus. As you know, this virus that causes COVID-19 is a coronavirus. It spreads person to person. And if we don't take all the precautions, then one person can give it to many others. So at home and at work also, we wanted to make sure that we do not spread the disease. So as you mentioned, there was a period when we are in total shutdown and we worked from home. And then gradually, the people who needed to be at office or work, they started coming. But we implemented a system so that we wear masks, we really maintain our distance from each other, and we wash our hands and also sanitize. Thank you for that.
I wear a mask in the office. It's just off, because if I wore a mask, I'd be muffled and people could not hear me. But I am double vaccinated, and I got to tell you, anyone that isn't vaccinated at this point is doing themselves, their friends, their neighbors, their family a disservice. You need to get vaccinated to get over. Did we have some reactions? Some people did. I got the Moderna virus at Brookhaven Hospital. I had no reactions other than a sore arm the first time for a couple days, and the second time, no reaction at all. My wife got the Pfizer at Stony Brook. She just felt tired for about a day or so. But you know what? It's a social obligation that we have to our friends, our families, our neighbors, our co-workers. Get vaccinated and continue, as I do when I'm walking in the hallways or in town hall or in my office, except if I'm sitting at my desk and I'm alone, I always wear a mask to prevent the spread of disease. You know what people have told me? We wore a mask and the virus is all over, but the one thing that was down this year is the flu and colds. And that's probably because we're wearing masks.
Is very true. That is very true. Mask does help prevent COVID. In addition, it also helps the other diseases. So what we are doing right now is we have been vaccinating, and we encourage everybody. As a healthcare worker, I strongly recommend that everybody come and get the vaccines. Why get the vaccine? We talk about that. The one thing is that COVID disease, if you have it, it can be really serious. You can get hospitalized. You can even die. So that will prevent from that disease happening. That's for your protection. Then you also have to think about your friends and family. If you have the infection, even without knowing, before you get sick, you can really give it to your friends and family and others. You don't want to do that. So if you get vaccinated, you can prevent that also. And also think about the things that you have not been doing so far. If you get vaccinated, you would be able to do some of those things. For example, you can really meet outside with people without wearing a mask and enjoy the day in sun. We also can think about inside. If you are vaccinated, you are supposed to be okay with meeting with people without mask if all of them are vaccinated. Even if one person or one family member from one family is not vaccinated, you can even meet with them without mask inside. So, and you can travel. You can travel if you have the vaccines without getting tested before and after what you had to do. So a lot of people complained about that. So all these things you can do if you get vaccinated. And also think at the end of the day, we want to have a normal life. We want to get out and do everything that we did before the pandemic. If we can control the pandemic, end of the day, if enough people get vaccinated, we would be able to do everything that we have done in our life. And we can't wait to do that. So if everybody takes it seriously, comes and gets the vaccine, that would be the day that we can really do everything we have done. In Suffolk County Department of Health, we are offering vaccine. We are really offering walk-in vaccinations. So anybody who wants, you don't have to make an appointment. If you want, you do have the option of making an appointment, but you can just walk into one of our vaccination clinics and would be happy to really vaccinate you. And also we have—
And the vaccinations are free.
Vaccinations are free.
That's
Absolutely
important to
free.
tell people. You don't have to rely on your health insurance or something of that nature. Vaccines are free. You get the shot because we know how serious this disease is and we're trying to shut it down.
Absolutely. Vaccines are free and you can come to any of our clinics and we have our nurses and doctors there. If you have concern, questions about the vaccine, hesitancy, come talk to us. We'll answer all the questions. And hopefully then you can be convinced that this is a safe and effective vaccine. And we took it, I took it, supervisor took it, and all our friends and family took it. Please come to us. We can answer the questions. Please get vaccinated.
That's great. I mean, we want to get back to a normal life. When we shut down, we had all of our senior centers in the town. We have a couple senior centers where seniors meet from different communities and get together. We had to close them down, and then we had to provide meals for them. We were delivering 525 hot meals a day, and we still are delivering meals. It's down a little bit, but we're still delivering those meals because we don't feel safe yet to reopen our senior centers. I was happy to see the county executive talking about allowing Duck Stadium, which is a local baseball team, to reopen at a certain percentage. And I'm happy to see that the restrictions on bars and restaurants are lifting slowly. I just hope that we don't have another recurrence. I see what's happening in Brazil. I see what's happening in India. And it's very concerning because, believe it or not, we think this is a big world. It's not that big. And diseases and viruses travel very, very quickly. Maybe you could talk a little bit about your concern about that.
Absolutely. So as you mentioned, supervisor, that we live in one world. So diseases spread from here to there, and whether you like it or not, they do come to us and we have to deal with it as it comes. So the more the virus transmits from one to other, the virus, we call it mutation, it changes. The more virus changes, the possibility of whatever we have, the vaccines and therapeutics, it may or may not work if it changes too much. As of now, whatever mutations we have, the vaccines we have, it works. So it's time for us to really get the vaccine so that we don't get into more mutation or more different viruses that may not work later. So I emphasize and again that this is the time to get the vaccine. Please come, take the vaccine. We can avoid the pandemic and also all those mutations just by taking the vaccine now.
Well, Doctor, you've been very informative and very helpful. Is there a telephone number that people could call who have questions or want to find out where they can get the vaccine? Do you have a telephone number available?
Right. So in Suffolk, we ask the residents to call 311, and our operators will connect to whoever we need to talk to. If there is a nurse or a physician that they need to talk to, they will connect them to with the nurse. And if they need to make an appointment, 311 can do that as well.
Okay. So that's a simple thing to remember. Do you have a website that people could go to? Because we'll put it up on our screen also.
Okay, so this is really Suffolk County government website. So if you go to Suffolk County government website for vaccination, where you go to is vax4.suffolkcountiny.gov. That's where you can go and register for vaccination or make appointments. And if you go to Suffolk County website, government website, you'll have all the information about the vaccine.
So you're making it as easy as possible. You have a call-in number, you have a website address, you come on Coffee with the Supervisor, talk a little bit about this. And I think at this stage, most people understand it's pretty important. And whatever doubts they have, there are very few reactions to the vaccine. The only reaction is that you're going to be protected against getting the coronavirus. So I would urge that. I know friends that have had the virus. I've known friends that have died from the virus. This is a serious matter. People really need to take this seriously, protect themselves, their family, their friends, their neighbors, their community. Let's get vaccinated. Let's beat this virus and put an end to this pandemic. And Doctor, I know we will do that with people as dedicated and knowledgeable as yourself. I want to thank you for being on this short message, and I appreciate you coming on.
Thank you so much. Thank you for having me.
Right. You have a great day, Doctor.
Thank you. You too.